Hi, I'm Rohrich. I'm a board-certified plastic surgeon in Dallas, Texas, and this is a good time to talk about tear trough fillers, and why I hesitate to do them frequently. It is so much about the patient selection. Tear trough fillers should probably only be done in a small percent of patients. Let me explain why. The anatomy is so complex for a tear trough filler. As we age, we get loss of fat in our entire face, and I describe that, the science of aging, in our journal, the Plastic Surgery Journal, PRS. But the most important thing you need to understand is that just because you can does not mean you should. So the proper patient, the best patient to do a tear trough filler on is one that probably doesn't need hardly anything. It's a young patient, good skin tone, no bulging fat, and just has a slight hint of a tear trough medially, because that's the most important and the easiest patient to get a good result. The patient that has a tear trough all the way across, or has extra skin or bulging fat, that's not a good patient. In fact, that's contraindicated. So know before you go. So the most important thing is patient selection and proper technique. And the proper technique is less is more. Use a non-hydrophilic filler, an HA, hyaluronic acid filler, like Restylane, and use only a small incremental amount from different angles, coming from the side and coming up. That's very important. And understanding the anatomy. The anatomy really is that there's a significant ligament that's very complicated. It goes all around the orbit, and really it goes from the bone, the orbital rim, all the way to the skin. So you can't really release that just with a filler. So the most important thing then is the injector, and also where you inject and how much you inject, a non-hydrophilic filler. So that's the ideal patient. So most patients, I would say 80% of patients that think they need a hyaluronic acid or a tear trough filler really shouldn't have it, because the downsides and the consequences of that are not good. I probably see once a week a filler done improperly or too much, and it ends up being a big sausage roll in this area, and it looks terrible, and it's hard to remove. So don't do it in general. And you know, the most important aspect is less. If you decide to do it, do only small incremental amounts, undercorrected. You know, probably using 0.5 cc's total of a hyaluronic acid filler. You can always do more, because once you have overdone it, trying to remove it even with hyaluronidase is really not a good option, because then you can get lymphedema or swelling in there that's a long term. So I think that's really an important aspect to understand. So I think really, in summary, highly selective, young patients, good skin tone, use a minimal amount, different directions, stay deep, and always stay below or just at the level of the orbital rim, and you can't really inject into it. And then the best way to really fix a tear trough is surgically. And really you do that by blending the eyelid cheek junction. And I talked about that in our journal, because really the lower eyelid rejuvenation is blending the cheek and also the eyelid, and that gives you a nice smooth contour. And fat, micro-fat or fracto-fat is the best way to do that. And that's really, really important to understand. And obviously that's a topic that will be discussed later. So know before you go, choose your injector wisely. Less is more, and most of the time, you're probably not a candidate for it. So find a board-certified plastic surgeon, dermatologist, oculoplastic or facial plastic surgeon that really has a lot of experience and understands the science of aging. And always, when you find an injector, make sure they understand all these things, and happy to share that. You can share this video with them as well. And I'll tell you, if you follow these few guidelines, it'll make your life so much better, and it'll keep you educated and informed about your own body. After all, you know, it is all about you. You are your best personal advocate for your own life, for your own beauty, and who you are and who you want to be. So like and subscribe to all my videos, because my goal is to help you be the best you can. Have a great one.